is spinning quite a bit. It says live, so.
Okay, yeah, we're counting down. So that's good though, because they want to, you want to be ready.
Right? Give me like a cue on your screen when it pops up.
Okay.
This is the ominous countdown in, what is it, 10, 9, 8, 7, 6, 5, 4, 3, 2. I think we're live. We are live. Isn't it amazing the technology that we have? Hey guys, Dr. Ernst here. I would love to see if somebody could just set up a little chat bar. It's either on this side or on this side. Let me know who's on. Maybe throw out a name. Just say hi. Robert, love it. Robert Martin, thank you for tuning in. Good morning. What a great opportunity. Listen, as you guys climb on, let's see. Yes, we're doing good. Everybody's getting on. Love it. Dr. Ernst here. Today, we're going to be destroying diabetes. And, listen, while we don't have the opportunity to congregate together, right? So Bill, great. Rob, great. Yes, feel free to just comment. Hey, just so we know that you guys are connecting, type maybe where you're from, where you're watching, etc. We have some incredible things for you today. Doug, thank you. Paul, awesome. Thank you. So we're going to get into the meat and potatoes today about how to destroy diabetes. And we're talking in 90 days or less. And I'm going to give you some little tidbits today. You guys are going to get all kinds of information. You're going to get free offers that we're giving you on how you can test yourself to see if you're a candidate to reverse diabetes in 90 days. If you have it, if you've been diagnosed as a type 2 diabetic, we're going to be helping you to see if you can find out what's your trend. Maybe you haven't been labeled as being a diabetic, but you're concerned, you got a family history, etc. You're going to get some free at-home testing instructions on how to find out where are you in the scale. If you know you've got it, if you're injecting, taking insulin, medications, today is the day, guys. Today is the day we destroy diabetes. So loving people hopping on. Danny, thank you. Dan, Doug, Paul, Bill, beautiful. Lucille, great. So obviously we're live. Omera, love it. We're live. So guys, I'm going to start to now get into this presentation because I see the majority of us are online. And here's the thing. I want to start today to give you some encouragement and some inspiration with a video testimonial from a patient of mine that I've been working with now for a little over a year, who was a raging type 2 diabetic, who did exactly what I'm going to teach you today. Took her sugars from being in the 300s down into normal. Guys, 300s into normal. So we're going to start our broadcast today by having you watch this video of Pam sharing her testimony, and then I'm going to go straight into it. How do we destroy diabetes in 90 days? How do you become an active champion and healer for your health? And how do you get access to all these awesome free offers and the discounts that we have for you to get testing done so you can become your own healer? Let's watch this video and then we'll begin. Hey guys, I'm so excited. I have Pam here, and we have something incredible to share with you about what's been happening with her sugars. So I'm going to let you share the story more just because it's so transformational. So.
Okay, well, I was diagnosed by my regular primary care physician of having diabetes type 2. My sugar at that time was 396, and my A1C was 12.7 according to his test. And I came to see Dr. Ernst because my doctor told me there was no hope. He immediately wanted to put me on metformin. I called them and said, can I just not take the medication, do something else? They said it was impossible. You have to take metformin. I said, can I do it with diet and exercise? Anything else? There's nothing else you can do. You have to take the metformin. And so I didn't feel that that was where God was wanting me to go. So I met Dr. Ernst on April the 19th. He ran his own blood test and showed that my blood work was 9.1. When I emailed him, I felt like I had no hope. And he reached out to me and he gave me hope. And I came to him and he shared with me how I could heal my gut, heal my back, and eat healthy and straighten everything out. And my success story is as of today, I got my blood work back and my A1C is 5.7. Yeah. I give God all the glory. I pray blessings upon Dr. Ernst's ministry because this is a ministry. I'm not just a person or a a number. I am a sister in Christ to him, and he cares about my whole health.
And so let me ask this. When you were at your medical office, did they ever test your gut to see if there was a bacterial relationship to what was going on with your sugars? Did they run like a detox test to find out if you had toxins or any issues? Did they take x-rays of your spine looking at the nerves that go to your pancreas or to the areas of your intestines?
Blood test only.
Yeah, and so the challenge is, of course, in their world, there is no cure because they don't test for the cause. When you actually get cause tests done and you fix that, of course, the human body has the ability to heal itself. So what a great, great story. What would you say for those who are watching this video about if they have diabetes, or even if they don't even know that they have diabetes, what would you say to somebody who's looking for a way out?
I would come to Dr. Ernst. He runs a full panel, gets all the answers instead of just a small view. He gets the whole panel done so you know exactly where you're at. And then he gives you a plan fit specifically for you to get you to move forward to meet your goal of where you need to be wholly healthy.
Yeah, that's beautiful. Thanks so much for sharing.
Thank you.
Yeah, thanks,
God
guys.
bless.
Yeah, so this is what I want to share with you. Did you guys hear that? Blood sugar's well over 300, A1C in the double digits, even with her best effort with medications, bringing it down to only a 9. We have a lot to talk about. We have to talk about what all these numbers mean. We have to talk about what is insulin and blood sugar response and A1C and even things like cells and cell membranes. So we're going to go deep into the science today. But as you heard, in as little as 90 days, Pam was able to bring her sugars down into the exact normal range, becoming from a raging type 2 insulin-resistant diabetic to pre-diabetes / borderlines of normal. And that's what my prayer and my hope is for you today. So again, if you're watching this online and you're taking a medication, you're injecting insulin, just then buckle your seat down, grab all the pens and papers that you can, because all the information today is going to help you to break free from that condition. And I've seen multiple people go from type 2 diabetic to pre-diabetic in 90 days, and even type 2 diabetic to non-diabetic in 90 days, because the power is in your control. You have to understand the science. You have to learn about insulin and blood sugars and the receptors and autoimmune antibodies. So today we're going to go real in-depth into it so you can see exactly what you need. I have a presentation I'm going to be sharing with you that's going to not only give you the in-depth information, but you're going to find out what are the tests to do. How do you ask your medical doctor when they won't run the test for you to be able to help you? Because they can't. The medical system is designed at managing a disease. Right now, type 2 diabetes is a disease of elevated blood sugars, but it's not the cause. It's a symptom. It's an insulin reaction where the body is not responding to its full capacity. There's a receptor interference, and those interferences come from 3 different categories. So as we kind of dive in today, don't forget, you can ask away some questions. I'm going to answer them after the webinar. You can stay connected and live with us. As we get close to the end of this presentation, which will be roughly about 45 minutes to an hour, I have a special opportunity for some free check-ins, some free nutritional advice, and for you to be able to get some testing at a significantly reduced price, partly because, again, most medical doctors don't test for cause. Okay, there is a known cause of type 2 diabetes, and typically, most likely, you've never been tested for that cause. So as we begin today, what I'm going to share with you are, 1, what are those tests? How can we get access to them? 2, why are the tests that your doctor's running only looking for the symptomatology? Why aren't they looking for the deep underlying root cause? 3, why are the medications that we're currently taking for type 2 diabetes making it worse? Why is it that a type 2 diabetic starts with 1 medication, metformin, ends up taking 2 or 3 or 4, and then all of a sudden has to start injecting insulin? We're going to talk about that today. And I'm going to share with you the #1 thing that I have learned after 10 years of clinical practice on how we can take a condition like type 2 diabetes and reverse it, sometimes in as little as 90 days, and help to prevent the future health issues that come. I think you guys might be aware that if you're a type 2 diabetic, you also tend to see elevated cholesterol, elevated triglycerides, obesity. It's not just a singular condition with sugars being elevated. It's a rampant syndrome. And if you want to solve this, you have to go deep into the science at the cellular level, which is what I'm going to share with you today, and how you can take control of this condition and become the healer yourself. Okay, so some basic terminology that you need to understand. #1, your sugar, your glucose, is simply a measurement of the amount of sugar that's physically in your blood. And it's usually in a range depending upon where you're at, either normal, functional, what I will call sort of the holistic level, between 65 and 89. So if you wake up in the morning after a good 8 or 10 hours of fasting and your blood sugars are beyond 90, that is, by a functional definition, pre-diabetic. Now, medicine will say you're allowed to have a blood sugar level at 99 or less and still be considered normal or okay. But I'd like to say to you, if you're getting into the 90s, that's a pre-warning, a precaution that your metabolic responses are not working properly. If you're waking up in the morning and your sugars are between 100 and 125, that's a red alert. You're in that early stages of pre-diabetes. The insulin receptors are being blocked, your sugars are not being metabolized properly, and that's the doorstep to then get into diabetes type 2, which would be a fasting sugar over 125. It's really, really important that we pay attention to our fasting sugar numbers. Even more important, something that most people aren't doing, which you can easily test yourself, is looking at how your sugars react after you eat a meal. So for example, if I consume a lunch, I'll set an alarm for 2 hours and I should check my sugars to see where I'm at. If you're healthy and active and whole and healing, your sugars will be well under 140. If you're in a pre-diabetic range, if this is a wake-up call for you to take action for your health, you'll be somewhere between 140 and 180. And listen, I hear it all the time. Dr. Ernst, I haven't been diagnosed as a diabetic. Why should I check my blood sugars if I have no symptoms, if I have no history, if I have no likelihood of developing it? Because listen, 80%, there's an 80% likely chance that you are in this pre-diabetic range by checking fasting sugars and checking your post-meal sugars. Okay, right now, diabetes is climbing an epidemic higher than ever before. You're gonna see some connections. There's specific things that have been done to our foods and specific things we're doing to ourselves that are setting ourselves up for this condition. And I'll break the mold. Diabetes is not a genetic condition, type 2 diabetes, not genetic. It's not something that runs in your family history. It's not something that you just get because of your age. It's a condition that's acquired because of having 3 levels of interference in your system, in your metabolism. When we break those 3 down and we correct them, you'll see the sugars reset and you'll see your health return to normal. So if you're eating a meal and 2 hours later, your sugars are between 140 and 180, wake up call, time to take action. If your sugars are well north of 180, then you're confirming to yourself you're in that type 2 insulin resistant diabetes and you need to take action now. You know, something of interest right now, a lot of people are concerned about this coronavirus, you know, and the reason we are having to do this webinar today is because they don't want people to congregate together for the fear that we will spread this disease, this infection that's going on. But guess what? The research is showing you're at a high likelihood if you have elevated blood sugars or if you're a type 2 diabetic. Why? Because it weakens your immune response. So insulin is the hormone that is responsible for your sugars to go into the cell tissues. It's produced by your pancreas. And here's something I find fascinating. I've been working with hundreds of type 2 diabetics. And when I sit them down and I go through a basic history and I say, okay, we see your blood sugars, we see your A1C, what are we looking at for your insulin? Most of them will say, I have never had my insulin tested. Insulin is a hormone that should sit somewhere between 3 and 8, what they call micro international units. Now, if you've never had your insulin tested, I'm gonna break the mold and break sort of this mantra down. Okay, most people understand that as insulin rises, blood sugar should go down. But we see an interesting trend with someone that's type 2 diabetic. We see insulin's elevated, and we also see blood sugars elevated. So the reason most medical doctors don't test for your insulin is they would have a hard time explaining to you why the insulin is high. You're gonna learn today why insulin elevates and blood sugar elevates at the same time, and how to fix it is not by pushing a medication. It's not by injecting more insulin. It's by going deep to the root. Fix the cell, fix the receptors, fix the communication. As you heard with Pam, fix your gut, your microbiome, and your body will naturally reset itself. The insulin receptors will repair, the insulin response comes down, the sugars come down, and the beautiful part of it is it's all something that you can do yourself with some guidance. Now, A1C, really important you understand this. It's the direct measurement of the amount of sugar that is coating the red blood cells in your body. So think of it as like how much sugar is wrapped around the red blood cell. The more sugar wrapped around the red blood cell, less oxygen it can carry. This is why as A1C climbs, it can literally become lethal simply because you're not able to carry oxygen on your red blood cells. A normal, healthy individual will have an A1C well south of 5.6, preferably 5.4, 5.3, 5.2. When you are in a pre-diabetic range, when your body's developing this condition silently because you can't feel it, your A1C is going to be somewhere between 5.7 and 6.4. So the defining factor of if you're a type 2 diabetic is, do you have an A1C north of 6.5? And I've seen some people, like you heard with Pam, it was in the double digits, then it was in the 9s, okay? To get your A1C down less than 6.5, you got to stop medicating. You got to stop treating symptoms. You have to go to the root cause. The only way for A1C to drop is for the red blood cells that are in your body to physically die off, for you to produce new red blood cells, and for them not to become sugar-coated. And that happens as a result of you going through a metabolic change over a 90-day period, which will explain how to do that. Now, the insulin receptor is by far the most important thing we need to pay attention to. It's a protein that's bound to the cells of your body that allows for insulin to land into it, and it opens the floodgates for sugar to go into your cell to be burned for energy. So here's what happens in a lot of type 2 diabetics. These receptors are interfered with, or they have been attacked. There's been an antibody response against them, or they are non-existent. The cells have stopped producing them. So what happens is you make more insulin to try to push the sugar into the cell. The receptor is either blocked, interfered with, or missing, and thus the sugar can't get into the cell. So the sugars start to elevate, and your doctors will see the elevation in blood sugars. Because there's more sugar in your blood cells become coated with sugar, thus the A1C rises. And I hope you get a chance to see the secret lies at the membrane. The secret lies at the receptor and at the sugar transporter. You correct that, and you will see your sugars start to reset themselves in as little as 90 days. Now, I want to make sure we're clear on a couple things. In the world of medicine, they describe them as being 3 types of diabetes. Type 1 diabetes would be somebody who can't insulin at all. Their pancreas is either been attacked, or for whatever reason, it is not producing an insulin reaction, so their insulin levels are low. Does that make sense why a type 1 diabetic generally has to inject insulin? And I'm going to share with you a little secret. For the longest time, we thought that type 1 diabetes was a genetic condition that you were predisposed and born with, and that there was no way to get rid of it. Well, I'm here to share with you today the current research shows the same things that cause type 2 diabetes is the same thing that causes type 1 diabetes. The only difference is it's activated in a youthful child state. Now, type 2 diabetes medically is something that we would term insulin resistant. It's what about 80 to 90% of diabetics have. They don't have an active insulin response. The receptor is not working. They can't push the sugars into the cells. And so we're being told you'll have to take a medication. Type 3 diabetes, relatively new, research within the last 2 to 3 years, is when a type 2 diabetic who has a lot of insulin and a lot of sugar but can't get the sugars down now has to inject insulin to force the sugars down, so they're acting like a type 1 diabetic. And it's also when the condition of having insulin resistance goes for so long that now the brain cells themselves become insulin resistant. It's very dangerous. That would lead to Alzheimer's and cognitive decline, dementia. So currently, they're now teaching if you don't control your sugars, or if you control them with medications masking the cause, making the sugars appear low, but they're not actually low, you burn the receptors out in the brain, and we start to see cognitive and neurological decline. Now, I'm going to share with you on this slide the fact that they're wrong. There's not a type 1 or a type 2 or type 3. Those are just diagnostic conditions of symptoms. And I hope you see this, of symptoms. Elevated blood sugar is a symptom. It's not a disease. It's not a cause, but it's a diagnostic criteria. We can test your sugars. We can test your A1C. We, as medical doctors, we can give you a medication. We can make the numbers come down slightly, just enough that you can say, yes, they're doing something, and we can leave it long-standing for a period of time. Do you know how many type 2 diabetics would say to me, well, I've been taking this medication for 5 or 10 or 15 years, and I've been told it's genetic and there's nothing I can do about it. That's not true. That's not the case. The functional classes of diabetes, the actual cause classes, neurogenic, microbiogenic, or toxicogenic. What this means is there's 3 interferences that create the inability for you to control your blood sugars. And look, it has nothing to do with your diet. are a lot of diabetics who say, I've switched my diet, I cut my carbs, I even went vegetarian or vegan, and my A1C and my sugar is still elevated. Red flag, red alert to say you've got one of these neurogenic, microbiogenic, or toxicogenic causes. Okay, so today we're going to break down each of them and discuss how you can find out what type you have. But I want to show this to you, okay? The rate of diabetes has been climbing exponentially, even more so within the last 15 to 20 years. And you'll notice something on this slide. In 1997, the trend changed. We used to see a trend pushing at roughly a rate that would normally make it so we're at about maybe 10 or so percent of the population. We're now getting to the point where, you know, we're looking into the 20, 30, 40% range. What I'm trying to show to you is this. In the mid-90s, we modified foods. We injected GMO. We started spraying with Roundup. We changed the grain consumption within the United States. And that one change is the number one for insulin resistance from a food source. If you're consuming grains, corn, wheat, rice, if they've been sprayed with pesticides or herbicides or Roundup, or you're eating genetically modified foods, the trend is showing that's an underlying root cause. So we know for a fact that we did something to the food industry that has also perpetuated this condition. That's why, yes, food is important, but you got to remember, it's not just the diet. It's not just the fact that you've been told that your whole life that it's a genetic condition that you'll have to deal with by taking medications for the rest of your life. You know, a lot of times I'd like to say, if you just want to manage symptoms, if you want to make the numbers look good, but you don't want to ever fix it, then just keep taking your medications. MD, managed disease, are really good at managing conditions. A real doctor, a reversal of disease would be you activating your healing power that comes from within, you turning on your systems for auto repair, addressing the 3 root causes, and the body heals by itself. Look at this. The average type 2 diabetic spends $4,500 per year treating and managing their conditions. Yet when you go to the root, you can see that you can actually release yourself from this. Okay, it's not a disease that you have to deal with for the rest of your life. Medications, right? Be careful. Just because you say, well, I take my sugars through my monitors, I'm getting good numbers because I take my medications, therefore I must be healthy and strong. Be careful. Okay, we're now finding out, new research is evident, if you're medicating your numbers and making them look good, you're still at risks for the downstream effects of having type 2 diabetes, because technically you still have it. You're just masking symptoms. 68% of diabetics who take medications end up having a heart attack. 50% will end up having diabetic neuropathy and losing some sort of their vision. 60% will still end up with the amputations due to loss of blood flow. Neuropathies, diabetic neuropathies. Look at the increased rates of Alzheimer's and dementia by not taking control of it. And look, the scariest of all, a reduction in overall life expectancy, partly because the medications themselves are toxic, and again, they're only addressing symptoms. To get to the root cause, we have to go away from what we're being taught. How about the diet? Look at what the American Diabetes Association says a type 2 diabetic should focus on. They should focus on low fat, high grains, and listen, I'm here to tell you, there are numerous studies showing a classic American diet, low fat, pastas, wheat, corn, rice, soy, is actually what's the primary major interference cause from a dietary perspective, creating type 2 diabetes. Did you know that Harvard is doing studies right now that says if you eat a high fat, low carbohydrate diet, you can actually decrease your likelihood of A, developing, and 2, also reversing diabetes very quickly. Now watch this. I pulled this for you guys from the diabetes.org website as far as what do they recommend a type 2 diabetic eats. Now take a look at this, top right-hand corner. Bread, cereal, potatoes, high carbohydrate grains are a majority of the recommended diet. Milk and dairy, again, a major majority. Yet those are known inflammatories, known high carbohydrate foods, and it seems odd to me that the very organization who's trying to help diabetics heal and become healthier would recommend foods that scientifically have been proven to create it. Oh, wait a second, maybe it's actually because by design, they want you to manage your condition instead of reversing it. Notice fruits and vegetables, meats, fish, fats, and butters, they're cutting down the ones you should focus on and adding foods that are going to help to continue this process. So yes, we need to pay attention to our diet. But remember, at the same token, Many of you have probably already cut out grains and pastas and potatoes and dairy, and yet your sugars don't fully reset themselves. It's because you need to address the underlying root causes. How about this? Most type 2 diabetics will also confess that their cholesterol, their triglycerides are off balance, and they more than likely are taking a statin. Or you might not be a type 2 diabetic, but you're taking a statin, and the research shows you're more likely to develop it. Now watch, 13 different studies looked at over 91,000 people and found if you just take one cholesterol drug on a daily basis, your risk for developing type 2 diabetes increases exponentially. What we now know is that statins actually increase insulin, and insulin is what drives the inflammatory process. Remember, we said type 2 diabetics have really high insulin. Guys, that's the problem. It's not the sugars being off balance, it's the fact that the insulin is too high. As you elevate insulin, you drive inflammation. It leads to heart disease. It leads to perpetuating of the type 2 diabetes. High levels of insulin will burn out the receptors and make them disappear. So insulin is the key. You have to pay attention to it. And look, when your insulin is high, it makes you age faster. When your insulin is high, it affects every level of your health. They're connected elevated insulins to being a major precursor for why most diabetics have high blood pressure, why their cholesterol goes up, why the neurotransmitters shift back and forth and we get moody and anxious and our anxiety levels shoot through the roof. Estrogen levels start to climb in men. Testosterone starts climbing in women. Inflammation increases, and here's the understanding, the challenge. Your high levels of insulin shut off your detoxification pathways. You're going to find out today that a major cause, big player in type 2 diabetes is toxin-induced resistance. So if insulin is high and sugars are high, everything else elevates, your ability to detox decreases, so your self-healing capacity gets shut down. Why do you think most medications will elevate insulin? Because secretly, it makes other conditions develop. Okay, blood pressure is because of insulin. Cholesterol is because of insulin. Your age is because of insulin. If you take these steps today that I'm going to share with you, you can bring your insulin levels down, your sugars reset themselves, and your body can heal by itself. Okay, so watch. What do we need to be asking for? What do we need to figure out? What are the tests that we need to have run so we can discover our underlying root causes? Okay, well, first, we have to see where your sugars are in the morning. Okay, so your serum sugars, what's in your blood? How much sugar do you have? Second, we need to get a baseline of what your A1C is. It tells us how active has your sugar response been. If your sugars are really high, your A1C will be high, and it tells us the relationship of the amount of blockage in blood. Look, we need to see how is it stressing out your heart. C-reactive protein measures inflammation at the cardiac level and also at your body. Homocysteine, a marker that tells us, are you inflamed at a cellular level? Ferritin, guys, it's the most important toxin that you must get tested. You're going to see today that ferritin has been connected significantly to creating type 2 diabetes because it gets inside the insulin receptor and it blocks its functionality. It's the toxin-induced method. And we need to know where your vitamin D is. If your vitamin D levels are low, your immune system doesn't have the capacity to self-heal. Also, we need to figure out what is your metabolism doing. Okay, this is a test that most medical doctors never run on their patients. Are you burning fats for energy? Are you burning carbohydrates for energy? Can you even produce energy? This is a sample of a lab from a patient of mine. And what you'll see here at the top where it says fatty acid metabolism, this is a person who's having a hard time burning fats. They're also having a hard time burning carbohydrates. So if you can't burn fats and you can't burn carbs, guess what? The only thing left is protein. Then we start to tear our muscles apart to create food for our body. And guess what? Protein turns into sugar. This is where a lot of people struggle and why their sugars are elevated, because sometimes your body is making its own sugar. Let me ask you a question. You think it's important to know this? Do you think it's important to find out if you're producing a level of oxidative stress when you burn fats or carbs to see what your energy response is? I'm going to say for you to destroy diabetes, you have to know what your metabolism is doing. This is a urinary sample test that is so easy to do. You collect the urine at home, you ship it out through FedEx, reports can come back, and the beauty of it is we find what kind of metabolism you have, and then we can teach you exactly how to create a diet and a detox process that will show you how to correct this condition, okay? Even more importantly is knowing what's going on in your gut. You're gonna see today research shows that if you have an overgrowth with bacteria, notice components of bacteria and yeast and fungal origin. See the black dots all way over there on the right side in the high zone, including the yeast? This is an example of a patient whose type of diabetes is the microbiome source. They have an overgrowth of bacteria, an overgrowth of yeast, and those metabolites are creating inflammation that leads to receptor damage, and therefore sugars elevate. So look, I hope you understand. You have the capacity and ability to find out your underlying root source. You can become a champion healer for yourself once you discover where your interference is. Guys, it's really not that hard. But yet, how many of you have gone to your doctor and said something like, hey, can I have my insulin tested? Can I have my ferritin tested? Can I get a leaky gut or a microbiome profile? And yet we sometimes hear this, right? We don't recommend it. It's not covered by your insurance. So maybe we shouldn't even go down that route, okay? In today's society for healthcare, you're gonna have to become the healer. You're gonna have to become the doctor. You're gonna have to take action and make sure you get stuff done and get the right kind of tests, okay? So 3 main causes: neurogenic diabetes, microbiome, and the toxicogenic. Nerves to the pancreas, nerves to the liver not functioning properly, your microbiome, the bacteria in your gut being out of balance, and toxins being present, blocking the receptors. So now we go deep into figuring out exactly how to clear this, and I want you to hear from a patient of mine who did exactly what I'm sharing with you today, and not only had a transformation take place in his life, but saw some of the best numbers he's ever seen. I met Donald back in 2019 at the beginning of the year. I want you to hear this, and then we're going to go into each 3 and how you can clear them. Here we go.
Hello, my name is Don Weaver. I'm 73 years old. In 2003, I was diagnosed with type 2 diabetes. Neither side of my family, mother or father, had any history of diabetes. I'm the first. However, it was the increasing cost of the diabetes medications to just manage the situation that led me to seek an alternative, and in turn led me to Dr. Ernst and his program. I started his program around the 1st of February. Let me give you some idea of my stats then and now. I visited my family physician in late January, and at that time my A1C was 10.1. I had a recent visit with him toward the end of March, and my A1C was down to 7.3. At the time I started the program, I weighed in at about 284 pounds. I'm now down to 239 pounds and hope to continue losing that weight. Also, since starting the program, I have been off of all of my diabetes medications, along with the ancillary drugs that accompany this condition, such as the statins and the blood pressure medicine. I'm really pleased with my progress to date in the program and look forward to seeing continued positive results from following Dr. Ernst's protocol. I can't say enough good things about Dr. Ernst. He knows his stuff and it's working for me. Also, the staff at his office is just outstanding. They're very, very helpful, very cordial, and it's always a pleasure to go in there to see them. There's an old saying, life's a series of trade-offs, and I could say in this situation that exchanging the diet and the lifestyle that I led before joining Dr. Ernst as opposed to the one that I'm following now is certainly a good trade-off in, again, that I don't have to be taking all these meds just to manage the situation, not to cure it, but to manage it. I don't miss at all sticking myself every day with one form of insulin pen or another, and the Big Pharma keeps coming out with a different one about every month. In any event, very, very pleased with the program to date, and again, I look forward to seeing continued positive results.
Isn't that amazing? Look at the transformation that can take place when you get to the root cause, the underlying issues. So we're going to now go into what I call the neurogenic type of diabetes, okay? There's an extremely high likelihood that if you're taking a medication, you're injecting insulin, or you are concerned about where your blood sugars are, that you have been mis- or underdiagnosed with this particular cause. What happens is your brain physically sends a signal using the nerves in your neck and your back to communicate to the organs responsible for insulin production and for sugar metabolism. Okay, I'm pretty sure you understand that your pancreas is your primary organ of insulin production. The pancreas itself is directly connected neurologically through what's called the vagus nerve in your neck. Now, just imagine if the neck is out of alignment, if you've lost your normal posture, if you have a shift within your head positioning, we can detect this by taking a special x-ray and looking right at that spot with that yellow circle. That is the zone between your skull and your first bone, which is called the atlas, and it's exactly where the vagus nerve exits. Now, I want you to sort of look at this x-ray, look really close at the section that is in a yellow circle, and you'll see that there's a nice open space between the two of them. Okay, this is what it should look like. If we're going to test you for neurogenic diabetes, we're looking to see, are the nerves blocked? So on this x-ray, wide open, clear, clean, we would say this person does not have neurogenic diabetes. Now, let's introduce you to a patient that I began working with back in 2017. By the way, it's now 2020. He is completely free of his type 2 diabetes and has been for the last 3 years, gets tested regularly and constantly has normal fasting insulin, normal fasting sugars, and great A1Cs, and you're going to see why. Now, I know you guys could potentially chat with me and just tell me, do you see this? Do you see at the yellow section where the circle is that the skull is closed down? There's almost no exit point for the vagus nerve to come out. This is a positive test for what's known as vagal nerve compression. Now, again, remember, the vagus nerve goes to the pancreas and tells the pancreas how to secrete insulin, so we would have an interruption in the insulin response. Second, the vagus nerve goes directly to your liver. Your liver is responsible for the metabolism and the burning of your sugars. Often what we see is someone who's been struggling to lower their sugars and has been managing it with medications tests positive for vagal nerve compression. Now, you say, well, what do I do about this, okay? If you've ever been to a chiropractor before, you have to understand there's many different types of chiropractors. A lot of them will say, where do things hurt? They'll do an adjustment, and then they'll ask you, do you feel better? Now, the challenge with vagal nerve compression is you can't physically feel it. It is not a nerve that creates a pain response. It creates organic control. So what you feel is you feel the inability for your organs to function. So your body's aware of it, but you might not be aware of it physically. So notice there's a technique known as structural advanced neurological correction, where we can do instrument-style adjustments. We can physically lift the skull, we can reset the bones, and then what we do is we take an x-ray immediately after the first adjustment to determine the amount of change. Now, again, this was the x-ray when he first came in. This is the x-ray after his first adjustment. Did his skull open up? Did that vagal nerve become decompressed? What do we see? Absolutely. Absolutely. Now, here's the reason why this is so important. If we can confirm through some structural change that the vagus nerve can open up, then we can teach him how to do exercises, how to do the right types of therapies to reset this, and it should stay stable and maintained. So watch, we would want to take an x-ray a little later on and discover 1 month into therapy, sustained and held. 4 or 5 months into therapy, sustained and held. And this is a gentleman who was struggling with type 2 diabetes for years, not only injecting insulin, but taking medications, and is now completely set free because they removed and reversed the vagal nerve compression that was present. Okay? Remember, your liver is also a primary control zone for your sugars. It's controlled by the vagus nerve, but also the nerves that come out the middle part of your back. So what we have is the ability to detect it. I want you to think of your spine as a fuse box. Okay? We all understand the analogy that if all the fuses are aligned properly, the electricity is flowing freely to all parts of your house or your building or wherever the fuse box is. If you look at this slide analogy where the blue circle is, can you see how those two fuses have been thrown? They're out of alignment. So those are not producing an electrical current to the region that is controlled by those two fuses. Let's say in your house, that's your dishwasher. Let's say it's your stove, your range, or your dryer, okay? You would physically be trying to get that piece of equipment to work, but it would be as if it was non-functional, non-active. Not that there's anything wrong with it. Okay, the dishwasher, the dryer, the range, they work. They're just not receiving power. Now watch, your organs work. They just sometimes don't receive power. Your pancreas has the ability to secrete the natural levels of insulin, but it could be blocked. The liver has the capacity to burn fats and burn carbs and reset your cholesterols, but it can't because it's blocked. This is what's called neurogenic cause, nerve created. Look at this x-ray. This is measuring the T6, 7, 8, 9 region for liver functionality. The x-ray should, on your viewing left, shows a spine that's completely straight up and down. Hips are level, the discs are thick. Now look at the x-ray on the opposing side, and you can see it's completely curved. Now, before you jump to a conclusion saying this person must be in a tremendous amount of pain, surely they would say their back hurts. Yet again, a patient of mine who has absolutely no pain in their back, but is dealing with type 2 diabetes, blood pressure, and cholesterol issues, taking multiple medications, seeking an answer, never been able to find the source, and we discover neurogenic cause. Man, I hope you guys can see this. It is an extremely important test to have run to see, do you have compression at the vagus nerve? Do you have spinal nerve compressions? Because it creates the neurogenic relationship to not only type 2 diabetes, but also to major health issues. Okay, why is it that you can't feel it when your spine's out of alignment? You know, we've had a lot of clients come in 40, 50, 60% spinal distortions, and they often say to us, why doesn't my back hurt? Okay, if you look at a nerve itself and you cross-section through it, the majority, 96% of nerve function is to make things work. Okay, the autonomic nerves, the yellow section, that's things you have no control over. Breathing rates, watch this, sugars, cholesterols. You can't consciously think your cholesterol levels up. It happens by itself. It's a signal that's being sent from brain to organ automatically. Now, motor control. I have the ability to move things when I want to voluntarily. That's also through a nerve. But yet the smallest part of a nerve are sensory, pain, posture, heat and cold. It takes a tremendous amount of nerve compression before you say, I can feel that. Now, if you are somebody who is trying to manage your sugars and you want to get off medications and you also have neck pain or you have back pain or hip pain or sciatica, that again should be a massive wake-up call as an indicator for a neurogenic cause. Okay, so look, because you can't always feel this, technology now exists where you can actually have a scan. It's a thermal heat signature scan to detect where is there compression potentially to a nerve. Notice how at the top, C1, red bar going straight across, it's a positive test for what's known as neurogenic interference at the vagus nerve. Okay, so we can test it by doing thermography, we can test it by taking an x-ray, we can locate its position, and the best part of it is, if you get the right types of therapies, you can physically see reductions in nerve stresses. If you get the nerves to cool down and calm down when they're blocked, organ function increases. Pancreas starts to produce a healthy level of insulin. The liver starts to become more active and more vibrant. You'll see sugar levels drop, cholesterol levels drop. Watch, you burn fat. You can physically lose weight by just reconnecting nerve tissues. And guys, I'm sharing this with you because being in practice now over 10 years, a lot of our patients will say, no one has ever tested me for this. And yet when we start to clear it, we see tremendous change, okay? Yet again, another testimony that you guys need to hear. Don has been working with me now a little over a year. He just out of the blue got diagnosed with type 2 diabetes. No family history, no genetic trends, and yet in just a matter of weeks was able to get off his medication. Let's look at this, and then I'm going to shift gears into the toxicogenic and microbiogenic causes of diabetes. Here we go.
Hello, my name is Don Weaver. I'm 73 years old. In 2003, I was diagnosed with type 2 diabetes. Neither side of my family, mother or father, had any history of diabetes. I'm the first. However, it was the increasing cost of the diabetes medications to just manage the situation that led me to seek an alternative and in turn led me to Dr. Ernst and his program. I started his program around the 1st of February. Let me give you some idea of my stats then and now. I visited my family physician in late January, and at that time my A1C was 10.1. I had a recent visit with him toward the end of March, and my A1C was down to 7.3. At the time I started the program, I weighed in at about 284 pounds. I'm now down to 239 pounds and hope to continue losing that weight. Also, since starting the program, I have been off of all of my diabetes medications, along with the ancillary drugs that accompany this condition, such as the statins and the blood pressure medicine. I'm really pleased with my progress to date in the program and look forward to seeing continued positive results from following Dr. Ernst's protocol. I can't say enough good things about Dr. Ernst. He knows his stuff and it's working for me. Also, the staff at his office is just outstanding. They're very, very helpful, very cordial.
Hey, so I realized that I've already played that testimony, and I apologize. My cue for slides got a little bit off track. But again, isn't it amazing to see the amount of change that can take place when you address neurological causes, when you start to go in deep to the toxic issues? Okay, so what I want to do now is walk you through how your gut is directly connected to the ability for these receptors to work. And in all fairness, the research that's been coming out in the 2018-2019 year is now suggesting that type 2 diabetes is actually an autoimmune condition where the antibodies that form go after the receptors, making them disappear. So thus, insulin levels stay elevated and your sugars stay elevated. Now, when we talk about what I will refer to as a microbiome cause, it is your intestinal permeability. It's the tightness of your gut. It's the bacteria and the relationship of what's in your gut. Okay, now watch. You have more bacteria in your gut by volume than you do total human body cells. And what these healthy bacteria do is they create a really tight junction for the cell tissues within your intestines. This is important because we want to keep viruses and bacteria and toxins out of our blood. Now, we know that there's a condition called leaky gut, which is where, because of dietary interference with grains, gluten, and certain medications that we take, the gut cells spread apart and we start to physically leak components of bacteria and viruses and pathogens and toxins into the blood. Now, here's why this is important. If you have a leaky gut, you have a heightened sense of inflammation and an autoimmune response where your body is building antibodies against bacteria, toxins, viruses, and pathogens. Now is that any exposure to gluten creates this. Okay? So I used to have people say to me, oh, I can eat wheat, no problems. I'm having oatmeal for breakfast every day. I do a whole grain bagel. I don't have any issues. Well, the research is clear and evident. The gluten that's found in grains physically lands on the cells of the intestines, causes them to split apart. Then we leak proteins, we leak nutrients, we leak viruses and bacteria into the gut, and that creates an inflammatory process. Now, watch this. The worldwide consumption of these grains, wheat and rice and corn, has been exponentially climbing. And what you would see if you overlay it is the rate at which we consume grains increases the rate at which we are now seeing this leaky gut microbiome disturbance. And it's almost a direct overlay with what type 2 diabetes or high blood pressure or even heart disease or cancer looks like. The more grains you consume, the more likelihood you have a leak to the intestine. Now, how would you know just based off symptoms if your gut's leaking? Okay, well, first of all, you could have any of these. Now, focus on the bottom right-hand corner. Blood sugar imbalances, high blood pressure, we start to see changes in your metabolism, the more likely your gut is leaking. Now, when you want to see if you have a gut leak, one easy, simple way to find out is how much fat is physically packing around your abdomen. The reason for this is if the gut leaks, your body in its infinite wisdom will say, send fat there. Pack the fat around the gut because fat acts as a trash can, a reservoir, a reserve. As you leak toxins and viruses and bacteria, they can be absorbed into the fat cells. So this is a test where you're looking at a composition report of somebody who stood on a scale that we have in our clinic. It lets the body be measured by fats, proteins, carbs, nutrients. It looks to see how much fat you have, and it tells us where it is. Notice 84.2 pounds of fat in the abdomen, 153 pounds of fat on their body. Guys, if you do the math on it, that's 55% of fat in the intestine. That is a direct cause of leaky gut. It tells us it's present. You can also see that their weight is elevated, that their water is low. It creates a great baseline for us to be able to track progress as you go through the healing response of repairing the neurological issues, of rebuilding the microbiome in the gut. Okay, back to the urinary samples I recommend This panel will actually show you the direct bacterial relationships within the intestines. Remember, they're talking about the bacteria should be protective. If they overgrow, they secrete these chemicals that cause a gut leak to take place, and then we get this autoimmune condition known as leaky gut. Notice in this patient who came into my clinic, they had the test run to see if they have the microbiome challenge. Starting from the bottom, fungal yeast marker extremely high. Working our way up, bacterial markers 1, 2, 3, 4, 5, extremely high. Go up above that, detoxification pathways off balance and disrupted. So this is a positive method of us looking to see, do you have the microbiogenetic version of type 2 diabetes? And here's the thing. Usually when I show tests, most people say stuff like, okay, so how much does this cost? Now, your insurance company is not going to cover this. There's no Blue Cross, Medicare, MedCost, Aetna that's going to cover this type of test. Why? Because it's causative tests. This isn't looking at, can we give you a medication? This is looking at what's going on. How could we potentially solve and repair this issue? Now, as a retail value, if you were to just go to the lab, it's by Genova Diagnostics, they would send you a box that you collect your urine at in the morning. And guys, it's got a sticker shock for you. It's a $1,300 test. Now that alone would make most of you probably say, there's no way I can test it, all right? Now watch, as a physician, we have the ability to order these at discounted rates and costs for you. It's what I said to you in the beginning, how you can save hundreds of dollars on a test. I'm gonna share with you in just a moment how you can cash in on that offer, save money, not only get the test at a reduced rate, but also get these free offers that we have for you, which is your at-home sugar challenge test, which is the ability for you to have custom dietary coaching while we wait for your labs to come back. We're here to help you to be able to clear these interfaces. Okay? Again, how many of you have ever talked to your doctor and said, listen, I'd like to see if I have this leaky gut test. I had a patient the other day say, can you show me the markers on this lab? Because maybe my doctor will be able to run this. And when they emailed me back, they said, the doctor said, they don't even know what these markers are. They have no way of doing it. I had another patient say that their physician said, there is no evidence that this leaky gut actually exists. It's something the functional doctors have made up as a way to sell cleanses and detoxes. Well, let's break that myth right now. We're looking at the hard science. Guys, this is a study that was published in 2015. 15? Yes, 15, where they're showing type 2 diabetes has a direct connection to the bacteria and the microbiome in your gut. Focus in on the highlighted section. The microbiome from the gut, or the metabolites from the microbiome bacteria in your gut, physically contribute to the integrity. Do you see it in the research? Integrity, the tightness, the junctions between. And what does it say? It creates a compromised barrier of leakage. There it is, leaky gut, which creates inflammation. And those mediators have been systemically connected to an increase in insulin resistance. Look, I'm trying to bring to you brand new information. Even the research is saying a gut leak is a primary cause of type 2 diabetes, of insulin resistance. Okay, watch this one. The gut microbiome as a potential target. Look, we're now starting to say maybe we could change the bacterial relationships within your intestines, and that would help you to heal from type 2 diabetes. I'm going to share with you that's exactly what we teach our patients. We walk them through a gut rebuild detox program. We teach them how to incorporate probiotics at the right time. We teach them how to use fermented foods at the right time. And we teach them how to not take antibiotics to kill the bacteria down, but to use natural enzymes and activators that will rebuild the intestines by itself. Again, look at the highlighted sections. Growing evidence for the cause of gut microbiomes within type 2 diabetics. There's an association between the disease, including obesity and type 2 diabetics, even fatty liver syndrome, because it's connected to the microbiome compilation. Thus, we should be able to teach people you fix the microbiome and you can potentially change type 2 diabetes. This is huge. This is huge. Now, what's this one? Remember I said to you before, type 1 diabetes, we always thought it was genetic. You were born with it. You have to inject insulin for the rest of your life. The research is saying, no, it's actually potentially a connection between a leaky gut in a child at a young age that leads to the inflammation and the damage that creates a loss of insulin through the pancreas. Recently, the role of the microbiome in the creation of type 1 diabetes has now been uncovered, increasing evidence that the bacteria in people who have type 1 diabetes is different than those in those that don't. So you have the ability to test to find out what does your microbiome look like. Do you have way too much bacteria, as you can see in this example? All the red H's under the bacterial general categories tell me as a holistic physician there's an overgrowth. That means there's a leak. When the leak is present, you're going to create antibody responses against the insulin receptor. When there's yeast, it's going to inflame the body. So what do? We teach our patients how to go through antifungal, antibacterial, non-prescriptive therapies, how to rebuild the microbiome back on track again with some dietary coaching, enzymatic coaching, supplements. And here's the amazing part about the human microbiome. It only takes on average about 3 to 4 weeks for it to reset itself. But you have to know what you're going after. If you're going after yeast, or if you're going after bacteria, if you're going after parasites, are the detox pathways where you have every capacity to be able to help to heal this. Now, as we shift into the toxicogenic, okay, I want you to understand this. There is a connection now that we are learning of a number one toxin that most people with type 2 diabetes have that have never been tested before, and it is called ferritin. Ferritin has the ability to land inside the receptor, physically block it such that the insulin hormone cannot get onto the receptor, and therefore you can't push sugars into your cells. Okay, when you have what's called toxin-induced insulin resistance, either ferritin or mercury or lead or thallium is flowing around in your blood and getting attached to the receptor, preventing it from occurring to allow the sugar to flow in. This is what is called a toxin-induced insulin resistance. Now, watch this. The research is showing that there are multiple levels of chemical stressors and inflammatory agents that come from us having these toxins within our body. One of the primary issues is that they now know, listen, if you're taking type 2 diabetic medications, metformin, glucophage, Actos, if you're injecting insulin, you have a 33% chance that you have this toxin-induced resistance. And here's the kicker with it. The medications themselves are toxic. They are only going to aggravate this problem. Remember I said at the beginning of this presentation, we're going to show you why the medications make the condition worse. All medications increase toxicity, increases the likelihood of you having this interference, and it's a 33% chance that if you're watching this video, taking medications for diabetes, you have this. And now here's the important thing. You just simply need to find out what the toxin is. If it's ferritin, it can be tested with a blood test. If it's mercury or lead or thallium or any of the other toxic heavy metals, it can be tested and you can discover how to get rid of it by doing what's called chelation therapies. Let's look at what the research shows. This article was published not that long ago where they showed a significant correlation between serum ferritin, the amount of ferritin in your blood, and the physical presence of insulin resistance, which is called diabetes, in a large population. The severity, watch, the intensity of your diabetes, if your sugars are in the 180 range, 200 range, 300 range, is directly connected to the level of ferritin within your blood. I've been doing ferritin tests on our patients for almost 10 years now. We've seen ferritins 3, 4, 5, 600, etc. Okay, look, if you are a female, your ferritin needs to be under 100 to be healthy and to not be interfering with the receptor. If you are a male, it needs to be under 150 not to be interfering. Some of you probably have never had your ferritin tested, and that's why we're walking around blindly trying to figure out how to fix our type 2 diabetes. If it's toxin-induced and if it's ferritin, you can see it on the labs. Do you see this? Ferritin score, 638 with a patient of mine that I've been working with recently. Note the fasting sugars, 162, A1C, 9.1. Guys, this was Pam when she first came in and said, listen, my sugars were north of 300. My A1C was in double digits. I run some tests, confirmed that they were there. She had done some diet changes. Her A1C came down, but it was still significantly high. But what was her underlying cause of it? She had the ferritin-induced toxin insulin resistance. Ferritin is a blood-borne iron-based toxin that your liver produces when it's toxic. As normal, healthy iron flows through it, and it produces this protein bound to iron called ferritin. As ferritin levels climb, they start to interfere with the receptor. So envision this. You could have a ferritin response creating the blockage to the receptor. Your insulin is being produced naturally because you have no neurogenic block. You have no microbiome issues. You can see where I'm going with this. You could be testing for 1, 2, 3, or all of them. If ferritin is in the receptor, insulin cannot land, so it just bounces off. The sugars can't get into the cell, and what we end up doing is we starve for energy. There's a cell within a cell, the mitochondria. It takes sugar and turns it into energy. This is why most type 2 diabetics say, I'm tired all the time, I'm fatigued, I'm gaining weight, I can't seem to recover. If ferritin is present, here's the kicker. You can chelate it. You can take oral products that will grab it and pull it and get it out of you. You can let it come out through the tissues by doing a detoxification. You would be amazed how many type 2 diabetics I've worked with that didn't even know that their ferritins were elevated because, again, most physicians don't test for it. Toxin-induced insulin resistance. Now, there are other toxins that can interfere with this. I apologize, I opened the wrong slide. There are other toxins that can interfere with this. First and foremost being, beyond just the leaky gut, beyond the toxins that come from ferritin, are the pesticides and the herbicides that we're being exposed to. When we look at things like toxic heavy metals that are sometimes found in food products, or the pesticides and the herbicides that are found in food products, the research is showing now that mercury, lead, and thallium are also primary interferers to the insulin receptor. Now, you might be saying to yourself, where on earth am I getting mercury from? Or how could I have lead or thallium within my body? Okay, first, mercury is found in the majority of amalgam fillings that are in our teeth. Now pay real close attention to this slide. You see tooth number 2 and 3, 14 and 15 that are circled in red. Guys, those are your upper back molars. Where do the majority of people have their amalgam fillings? Yes, in their molars. Now, the upper back 2 molars neurologically, energetically are connected directly to pancreas, stomach, thyroid, and breast tissues. Pancreas, do you see it? If you have high amounts of mercury in those fillings, they leach through the teeth, they get up into the nerve tissues, and they start to directly affect pancreatic function. If the fillings are on the lower part of your teeth, they affect the liver, they affect the intestines, they affect the lungs. So having fillings down here can actually perpetuate a gut leak. Having fillings up here can perpetuate pancreatic dysfunction. Mercury, lead, and thallium be the interferences to how your body's not responding through the insulin receptor properly. Herbicides, pesticides, toxins that are found on our food. This is a slide showing the amount of diabetes, yellow bars, at a rate of its progression since about, 1980 it looks like. And you see the green bar that's going across is the normal trend line of what should have happened. We should have only seen a subtle climb in type 2 diabetes over the last 5, 10, 15 years. In the mid-90s, 1996, 1997, genetically modified foods were introduced. The blue line, see the genetic modification? We started spraying Roundup and glyphosate on corn and soy, the red lines, and we started seeing diabetes match almost exactly that relationship. What we know now is the pesticides and herbicides found on non-organic foods create a direct problem with the receptor by blocking it. The amazing part of it is the urinary panels that we use, you can detect the amounts of pesticides and herbicides. You can look directly into it. And I've got one last testimonial for you guys before we close out today. So you can see exactly what happens when you get rid of toxins, when you clear the receptors, when you remove the microbiome interferences. And that's Chuck, who went from full-blown type 2 diabetic to pre-diabetic, kicking medications off in just a matter of 90 days. Let's hear from him, and then I'm going to share with you how you can get these special offers, get the test at reduced prices, and become your own healer so you guys can clear this out. Here we go. Let's listen to Chuck.
My name is Chuck, and I've been a patient of Dr. Ernst since late April. Just want to tell you a little bit about my story. I've been a diabetic for 12 years, and I came to Dr. Ernst and started his program of helping my spine, correcting my spine, healing my leaky gut, and detoxifying. Before I came here, I was on 5 different medications for diabetes. My sugar, when I got up, even with those 5 medications, was 125 to 150 when I woke up, and when I ate, it would spike up to 240, maybe 300. But now, after being here and being under Dr. Ernst's protocol, I've lost 16 pounds. I have come off of 3 of my 5 medications for diabetes. My sugar, when I get up with those 3 medications no longer being used, is around 100. And even when I eat, it's only about 115, 120. And it's pretty level during the day. I'm just really excited about what's happening in the weight loss. Recently, I went to my own family doctor for a 3-month checkup, and he was absolutely astonished at the figures when they did the test. My A1C was 6.3. It has never been that low in my entire life. I was so excited. As I left, my doctor said, "Chuck, you have made my day." He said, "Whatever you're doing, keep doing it." So I encourage all of you out there that are here to listen to Dr. Ernst, to consider, listen to what the information that he has, and make the leap of faith like I did. Step out so that you can take care of your own health, be your own doctor, and take care of your own health. Thank you.
Isn't that amazing to see? Significant reductions. I think the best part of me is how he was taking multiple medications, trying to manage this condition. He started to apply the techniques that I'm sharing with you today, testing the microbiome, looking for toxin-induced resistance, clearing out neurological responses, and had such a drastic change that his numbers were the best he had ever seen. And I remember the day Chuck came into me and said, "My physician is saying, how did you do this? What have you done?" And he shared with him exactly what we're doing. And he goes, "You know what? If it's working, keep doing it." Chuck is now into a fully non-diabetic state in a healthy healing reaction. And then this is exactly what you have as an opportunity for you to do. Okay, so 3 main underlying root causes. Again, we don't want to treat symptoms. We don't want to manage our disease. We want to get to the root system, repair them, and allow the body to heal by itself. You've been given this innate, God-given, born capacity for regeneration, but if it's interfered with, it can't happen. So leaky gut, the microbiome disruption as a primary cause of autoimmune antibody production that goes after and attacks the insulin receptors. The toxic-induced insulin resistance, ferritin, pesticides, herbicides, mercury, lead, thallium, all get into the receptor and block the ability for insulin to work, thus sugar levels climb. The neurogenic cause, the vagus nerve, the mid-thoracic nerves that don't allow for brain to organ communication, and they don't allow for your body to actually go through a process to keep the insulin at a low state and keep the sugars down and metabolize the fats, proteins, and carbs the way they are. So here's my question to you, and I applaud you all for staying on this webinar. I haven't seen a single person hop off, which is incredible, but I'm wondering, have you had these tests done? Have you had a leaky gut microbiome profile done? Have you ever been tested for cellular inflammation or toxicity from a functional perspective? Getting not only just fasting sugars and A1C done, but ferritin and enzymes and nutrients, vitamins, proteins, your metabolism. These are the tests that we use. This is how I teach people and coach people how to repair their diabetes by going to the root causes. Have you ever been checked for vagal nerve compression? More than likely, the answer is probably no. Now, here's what I'd like to offer to you. We're going to close this webinar in just a moment, but you have to understand you're about to do one of 2 things. Go about your day the way you normally do. If you're taking medications, it would probably mean that you're going to have to take it tonight, tomorrow, and the next day to try to control your sugars. I'd like to inspire you by looking at the quote from Robert Frost on taking the road less traveled when you're at a fork in the road, right? The road was diverged into wood. The less traveled road is the one that makes all the difference. And I promise you, the less traveled road for type 2 diabetes is getting the test done to find root causes, clearing out toxic interferences, removing neurological interference, and letting the body heal by itself. The most common route is take a medication, try to control your diet, cut your fats, follow the dietary guidelines of the Diabetic Association. And many of you have been doing that for years. So it's kind of like today, you have that opportunity. Today, you have a chance to make a difference in your life so you can find the underlying roots. Now, I'm offering for anybody watching online today, multiple offers that are going to save you a tremendous amount of money. Number one, we call this the ultimate experience for your health. Okay, retail value, if you file this through your insurance, which again, they do not cover, but they'll still set the price, is about $2,400. Why? Okay, neurological testing, thermography, x-rays, an adjustment, a re-x-ray averages about $300 to $350 in most chiropractic clinics. The leaky gut test that I mentioned to you, looking for the amount of fat and its distribution, how much of it's in your abdomen, is about a $50 to $60 test if you were to file it through your insurance. The blood exams that look for ferritin and toxins and interferences at A1C range on average about $800 to $900 if, again, filed through insurance, and they'll claim it's non-covered. The functional urine exam that looks at your microbiome, the Genova box that is so easy to do, we send it straight to your house. You don't even have to leave. So you get to stay at home and do your tests at your house. The results come directly back, and what you'll get is 3 separate visits in my clinic or with us to go over the results, do a test therapy, see how you respond to it, and come up with a custom targeted program of either detoxification, microbiome rebuilding, nutrient profiling so your body will heal by itself. This is a retail value of $2,450 if you were to pay for them individually or through your insurance company. Guys, we have the ability to get it at cost. I can buy the labs for you. I can order the tests. I can send them straight to you. It costs $897 for you to get all of those done. But look, we're going to throw some additional offers on top of it because of this being a webinar. Okay, number one, you're going to get an email from us that shows you how to do an at-home sugar challenge test to find out if you're a candidate to reverse your diabetes in 90 days. You're going to find out if it's a leaky gut issue or if it's a toxic issue. But then second, you need to know what's creating it. Okay, so the urine profiles and the blood exams will tell us just that. You get a discounted rate on the tests, and you're going to see in just a moment, an offer button is going to pop up for you to be able to, do this. Somewhere on your screen in the corner should be a button that says click to request testing and examination. Okay, when you click that, it's going to take you to a page that looks like this that will say from Cornerstone Center, my organization, the ability for you to request these labs. Once you hit the checkout button, it's going to ask you to enter your information. Simple. Email, address, name, phone number, so we can reach out to you and connect with you. Because it's a webinar, here's what we're going to do. Once you order the tests, we're going to ship this directly to your house. It's the urine sample along with the instructions on how to collect it so we can see your toxicity profiles. We can look at your microbiome workup. We can find out what your metabolism is doing. This is the test that tells us the kind of diet you need, specific for you. This is the test that shows us what nutrients are you missing and how do we need to supplement. It's the test that shows, are you toxic with pesticides and herbicides? Do you have a microbiome leak? Is it bacterial, fungal, or parasitic sourced? This is one of the most important tests. You do it at your house. Second, we're going to email you a form that you take to LabCorp to be able to get your blood work done. You physically just walk in, hand them the document, they charge you nothing, and you get the entire blood test done. It takes on average 2 weeks for tests to come back. So here's the additional exclusive offer. During the 2-week window of when your labs are being done, you'll get a call directly from myself and our clinical nutritionist. So once we see your sugar challenge test that we're going to email to you, those results will help us to custom create an intermediary plan. You'll get some diet guidelines. You'll get some nutrient coaching for you to automatically start reducing your sugars by the time your labs come back. You have an extremely high likelihood of clearing out whatever you are dealing with your sugars, be it type 2 diabetes, or if you're now injecting insulin. You can repair this if you find underlying root causes. My clinic is located in Charlotte, North Carolina, if you're local, but watch. We work with people all over the world. I have some clients in Canada, Israel, Mexico. Because of the technology we have today, your lab reports can come back. We can open up a direct window and be able to communicate through the internet and teach you exactly what you need to do. There are in-office exams, the neurological testing, and the spinal thermographies that we do in our local clinic. And again, for those of you in the Charlotte and surrounding area, we're located just immediately on the north side of Charlotte, adjacent from the North Lake Mall at exit 18. Again, You'll get all the information you need to you. All I need to know is, are you at the point where you're saying, this is it, I'm ready. I want to go the functional route. I want to go the road less traveled. I want to get tested to see if I have neurological interference, if I have a toxic interference, if my microbiome is destroying my health. I promise you this, if you have 1, 2, or all 3, you will know exactly what you need to do to fix it. We're going to teach you and educate you and give you the tools and the tips based upon your exams, because each of you is unique. It's custom. It's specific just to you. Some of you might have a leaky gut, but not the toxic interference, and you'll have the neurological, so we developed that program. Now, another exclusive offer for those of you watching, if you request the consultation, testing, and exam through that link that we put up, you're going to not only get the lab sent to you, your blood work, and the microbiome testing, you're going to get 3 in-office visits directly to us. But watch this, as a way of just saying, I love that you guys were on today. God has blessed our clinic beyond our wildest dreams. We do what's called a pay it back offer. You get the testing done, you buy them $8.97. I buy them $8.97. I ship them to you. We're at a neutral of 0. We go through this testing process. We see the results. We do your test therapy. We see how you respond. We develop a custom program. And now here's the pay it back. I will give you a credit of $897 back into the potential future cost of whatever you need. It's almost my way of saying, if you let me see what's going on, I'll give you the money back that you spent on your test as a credit towards either your detoxification program, your chiropractic physical therapy program, or your leaky gut microbiome program. It is an offer that's available for those of you who are watching this webinar today. So I highly encourage you, if you're ready to break free from type 2 diabetes, if you're ready to kick medications to the curb, if you're ready to lose weight, feel great, and become an energetic self-healer, click offer on whatever side the screen's on. And again, remember, it's your decision that determines your destiny. You get to decide success, failure. All the difference between the two of them is do we take action? Do we make a decision? Do we follow through with it? And do we get the results that we need? Your body is so powerful. It has the ability to self-heal itself, but if it's interfered with, it's going to struggle and it can't do that. Remove the interference, body heals by itself. It is by divine appointment that you have been here today. I truly believe that God has you in this place, in this virtual environment, so that you can hear the information you need to heal. I thank you so much for the opportunity to be able to be with you today. Don't forget, there's a chat window. I'm going to hang around here after this webinar for about 3 or 5 minutes. I'm answering questions specifically, and then I look forward and hope to see you guys sometime in the future in the clinic with your tests, your exams, and the fact that you get to become the next greatest testimonial when I host this live event again. Again, thank you for your time. Love the fact that you were here today. And I'm going to leave this up in case you guys are going to do that offer. And I look forward to seeing you on our next webinars. Thanks so much. Bye-bye.